So I'm Dr Jonathan Leach. I'm the clinical lead for 111 in the West Midlands and a GP from Bromsgrove in Worcestershire.
What is 111?
So 111 is a 24-hour service. It's free to call. You need a penny credit on your mobile for it to be free. It's free from landlines, and if you have a penny credit on your mobile, then you get that back. Patients who think they have a health concern, but not one which requires a 999 can phone in.
So if you can talk us through the average call, what kind of advice will people get?
Initially, their call's dealt with by a call handler, and actually they take the patient through a very, very detailed analysis and assessment system, and actually then guides them to where may be most appropriate. So it may be that they need to go and see their GP, it could be that they're recommending a pharmacy or a dentist, or even occasionally to hospital. If when the patient phones they think there's an emergency, so say somebody with chest pain, they do have the ability to be able to dispatch an ambulance using a 999 system. The other thing is that when patients phone in, and let's say they've got a complex problem, we have a large number of clinicians, generally it's senior nurses and senior paramedics, who actually the call will be transferred to them, and what they will do is use their clinical skills in order to then assess what the presenting problem is with the patient, to actually then guide them in terms of what they should do.
So 999 is obviously only for real emergencies. How does 111 differ?
999 calls would be things like somebody who's had a cardiac arrest, somebody who's had a car crash, somebody who's fitting. So these are true life-threatening emergencies, and the ambulance service will deal with those. So 111 is for those medical conditions which are not life-threatening but still of concern. So let's say, for example, it was a child with a high fever, maybe it was an elderly patient and they were becoming more unwell.
What time of day should people call 111?
So 111 is a 24-hour service, so you could ring any time of the day or night actually, and it's 7 days a week. But what we would generally suggest is if people are unwell or think they're unwell during the working day, then they should contact their GP surgery or go to their pharmacy as they would do normally. But obviously 111 would assist if the patients rang.
And how many calls do we see on average?
So across the West Midlands now, it's about 100,000 calls a month, which is a very significant number. And it's about 15 million right across England.
How is 111 helping our whole healthcare system across England?
What 111 is trying to do is to actually more appropriately guide patients to the right type of care that they need. And in particular, trying to only send those patients who need a 999 or an emergency department hospital approach. We only want those who need that to go there.